Hello guys, good evening to all of you. Kohli, hi. And we are already on to the third live session, and I could not do it on Sunday because I was not in Delhi. I was in Hyderabad for a class. But anyways, as I said, if I'm not available on Sundays, I'll conduct the class some other day. And you can anyways, anytime, because I'm not deleting these sessions. You can come and watch whenever you want to, whenever you have time. So today's topic of interest would be anti-cancer drugs and endocrinology. So I have picked up the INI-SET PYQs of the last 2 to 3 years since when INI-SET came into existence, and we'll discuss about those. Good evening, guys. So let's carry on with today's session, guys. I'll not waste much of your time, and straight away we'll begin with a topic of interest for today. So what's that we are interested in today is anti-cancer drugs and endocrinology. Now, if I am preparing for the INI set, I need to focus on some important topics of anti-cancer drugs. They can ask anything, but we have to be prepared with the, talk of the town for the current times. In anti-cancer drugs, most of the MCQs which are being asked nowadays in INI set, the anti-cancer drugs are usually asked by the AIMS Institute, and these are about the immune checkpoint inhibitors. They are being asked. So we'll do that. Today we'll begin with an MCQ of INI set May 2022, right? And the MCQ goes like this: which of the following is not a checkpoint inhibitor? In other words, they're asking about, these are called as immune checkpoint inhibitor. So they're asking which is not an immune checkpoint inhibitor, right? Kohli, guys, whatever doubts you have, I'll talk about your doubts at last. I'll cover whatever doubts you have. Whatever doubts you have, I'll cover at last. To begin with, let us start with what are the MCQs. Right. So which of the following is not a immune checkpoint inhibitor? So this is an MCQ which has already been asked. And in fact, there are 3 MCQs which have been asked in the last 2 years related to immune checkpoint inhibitors, and I'll discuss most of them. So come on guys, come on, let me know what is the answer. What do you guys think? So excellent, most of you have given the right answer. Yeah, the answer is cetuximab. And what is cetuximab? It is a blocker of EGFR, or epithelial growth factor receptor blocker. So these are all immune checkpoint inhibitors. Now see, to be prepared for the exam for newer MCQs, I'll tell you whatever is important in this class. So number 1, see, the mnemonic immune checkpoint inhibitors. Immune checkpoint inhibitors are made a mnemonic for this, and you can remember as new star drugs acting at immune checkpoint. From new, nivolumab, star, dostarlimab, which was last year approved for prostate cancer. Drugs, durvalumab acting avelumab at atezolizumab, immune, ipilimumab, check, semiplimab, point, pembrolizumab. So whenever they ask you this MCQ, if it is repeated again, at least I have to remember which are the immune checkpoint inhibitors and this mnemonic. See, you don't need to write it down now. You just have to go to my Insta profile. Into my Insta profile, it is Doc Pharmaniac. And in my Insta profile, check for the highlights. There are different highlights. In the section of highlights, you will find mnemonics, and all these mnemonics, they're present. These mnemonics are present there. You can just go and take a screenshot or write whatever you want to do, right? So immune checkpoint inhibitors. Now, uses of immune checkpoint inhibitors, they've asked MCQs. Now, to remember the uses of immune checkpoint inhibitors, so I'll tell you few of them which are important. Atezolizumab, right? So, so at least remember ATE, 8, a big muli, you know what is muli? And big for breast cancer, triple negative breast cancer, remember, triple negative, not for ER positive, HER2 positive. ER positive, HER2 positive, all of you know what we use. M for melanoma, U for urothelial cancer, LI, liver cancer. Durvalumab, Durlav. So, you know, there is an Hindi, a word in Hindi called as Durlav. Durlav is which is rare. So, L for lung cancer, U for urothelial cancer, B for bladder cancer. So, these are mnemonics. They are present on Instagram. I posted these mnemonics. Already I had posted because I know these will be asked in the upcoming exams, right? Second, Avelumab. Avelumab, so Abhi drinks rum, right? Avelumab, renal cell cancer, rum, renal cell cancer, urothelial cancer, Merkel cell cancer. Now coming to an important one, pembrolizumab. See, uses of pembrolizumab you can remember as Pembroli, primary mediastinal large cell B cell lymphoma, endometrial or cervical cancer, melanoma, Merkel cell cancer. So these are the skin cancers. Breast cancer, again, triple negative breast cancer. Renal cell cancer, urothelial cancer, esophageal or gastric cancer, liver cancer and lymphoma, Hodgkin's lymphoma, and intestinal cancer, colorectal cancer. Pembrolizumab uses have already been asked in ionized set, right? The remaining two, ipilimumab, you can remember pili. Pili is yellow. Pili hai meri lung, kidney and colon, right? Hai hepatocellular cancer, melanoma, mesothelioma, lung cancer, renal cell cancer, colorectal cancer. Avelumab, I've already discussed, so it is a repeat. All right, so these are the important points about the immune checkpoint inhibitors. Whatever drugs you have, MCQs will be repeated. Just go to the Instagram, find out these, write it down, you know, in a piece of paper and paste it to the wall if you want to remember them for the long term, because you need to revise them frequently. So, which brings us to an MCQ of ionized set May 2022. Another MCQ. Which of the following checkpoint inhibitor is used for treatment of endometrial cancer? So I told you, right, 3 MCQs have been asked in the last 2 to 3 years. Which of the following checkpoint inhibitor is used for treatment of endometrial cancer? Which of the following checkpoint inhibitor is used for treatment of endometrial cancer? Right, so just now I told you guys the uses of pembrolizumab. Come on guys, what is the answer here? I've already told you the uses of pembrolizumab. So pembrolizumab, it is the one that is preferred for treatment of, I just now discussed, you can see here, pembrolizumab, here E, for endometrial cancer, cervical cancer, we discussed, right? So they have asked you here about endometrial cancer. From E, you can remember, it can be used in endometrial cancer. Another MCQ which has been asked, ionized said June 2021, nivolumab is used as a checkpoint inhibitor in nivolumab. Where is nivolumab used? Where is nivolumab used? So nivolumab, I missed it somewhere, I think. Right. So what is the answer, guys? Nivolumab, it is an immune checkpoint inhibitor that is used for treatment of, the answer is D, Hodgkin's lymphoma. Nivolumab is used for treatment of Hodgkin's lymphoma, and I've given the mnemonic as well for this. It is present on Instagram. Go to Instagram and find out the mnemonics for all of these immune checkpoint inhibitors. So immune checkpoint inhibitors, you can have one MCQ, and this MCQ would be a difficult one because you have to remember a lot of drugs and a lot of uses. So this can be rank deciding, right? So Hodgkin's lymphoma. All right, match the following drugs in column A with their targets. Right, column A with the targets. This is an MCQ Pioneer set November 2021. So this is one of the recent MCQs. Trastuzumab, infliximab, sirolimus, imatinib. So what's the answer, guys? What's the answer? So see, as I have said already, right, you do not need to fear the match the following MCQs, because the difficulty level is not in the match, but compiling the match and get the answer right. So all of you know trastuzumab, HER2, infliximab, TNF alpha, sirolimus, mTOR, imatinib, BCR, ABL tyrosine kinase. So A4, A4, B3, A4, B3, C2, A4, B3, C2, D1. Excellent, guys. So all of you have given the right answer. So as I've said, time and again, you can look at any of the match of the following. So you don't need to worry about match the followings, right? The reason being, they are usually, any MCQ that I've seen, they're usually on the easier sides, right? Now again, an MCQ of mine I said November 2022. So these are the recent MCQs, but you can see these are not difficult ones. These are easy ones. Rituximab is a monoclonal antibody which acts against CD22, polyclonal antibody which acts against CD22, monoclonal antibody which acts against CD50, polyclonal antibody which acts against CD50. So it's a repeat MCQ. It has more than 10 uses you have for rituximab, and it's very good, guys. Most of you have given the right answer. Rituximab is a monoclonal antibody which acts against CD22. So this is a MAB. It's a monoclonal antibody. It's not a polyclonal antibody. So whatever, see, anyways, it's a stupid MCQ. The reason being, why I'm saying it's a stupid MCQ, the reason being, if you look at any drugs that ends with MAB, MAB itself stands for MAB itself stands for monoclonal antibody. So any drug that ends with MAB is a monoclonal antibody. So rituximab is a blocker of CD20. Is important. Achha, I'll just ask you one MCQ. Which drug blocks CD80-86 blocker? That's just a random question to you guys. Which drug blocks CD80 and 86? Which drug blocks CD80 and 86? CD80-86 blocker का नाम क्या है? Anyone? So it came out of the syllabus, right? CD80-86 blocker. Any drug that blocks CD80-86. Now see, I'll tell you a story. I'll tell you a story here so that you can remember CD20 and CD80-86 blocker, right? So CD20 blocker, all of you know, it is rituximab. CD80-86 is rituximab. So the story goes like this. Ritu. So you fell in love with Ritu. You fell in love with Ritu when she was 20 years of old. So 20 years of age. And then you married her, right? Because of sheer love. तो आप रितु से मिले जब वो 20 साल की थी. प्यार हुआ आपको. प्यार होने के बाद क्या होता है पता है आपको? शादी होती है, राइट? शादी होने के बाद अब शादी हो गई. अब आप हो गए हैं, पहले आप कितने साल के थे? अर्लियर यू आर 20 years of age. नाउ यू आर 80 to 86 years of age. तो अब आप बूढ़े हो गए. और जब आप बूढ़े हो गए, the drug that blocks is called as abatacept. The drug that blocks is called as abatacept. So जब आप 20 साल के थे तो रितु से आपको प्यार मिलता था. अब आप जब 80-86 साल के हो गए तो आपको रितु से सिर्फ बाटा का चप्पल से सिकाई मिलता है, राइट? सो दिस इज स्टोरी टू रिमेंबर. CD20 blocker and CD80-86 blocker, abatacept. Both are used for treatment of rheumatoid arthritis. So if they ask an MCQ on abatacept, it can be about its use, that is rheumatoid arthritis, rituximab, CD20 blocker. So this is just a small story to remember about abatacept and rituximab, right? All right, let us move on. Right, yes. Match the side effects of the following drugs. Match the side effects of the following drugs. All right, what is the answer? Match the side effects of the following drugs. So it's an easy one, guys. Again, it's not a difficult one. So methotrexate. All right. A is not correct, guys. See, methotrexate, why it is not correct? Because methotrexate causes mucositis. It's not caused by any other drug. Acitretin, it can cause abortion. Cyclosporin is nephrotoxic. Thalidomide is teratogenic. See, acitretin is also teratogenic. See, this is where the difficulty lies in match the following, because you can have one side effect that can match to more than one drug. Like जैसे कि यहाँ पे एसिट्रेटिन थैलिडोमाइड दोनों टेराटोजेनिक है, राइट, दोनों टेराटोजेनिक है, बट आई विल चूज थैलिडोमाइड फॉर टेराटोजेनिसिटी, एसिट्रेटिन फॉर एबॉर्शन, right? So here D is the right answer. D is the right answer, and this is where the difficulty of match the following lies. All right, now moving on to the next PYQ, guys. PYQ of ionized set May 2022. Oral hypoglycemic agent causing bone fracture in female. Oral hypoglycemic agent causing bone fracture in female. What is the answer? Oral hypoglycemic agent causing bone fracture in female. Come on, जल्दी जल्दी बताओ आंसर क्या. देखो ये रिपीट क्वेश्चन है, ये रिपीट क्वेश्चन पहले भी पूछा गया है. So your answer will not be B. Answer will not be B, because B is not the answer, guys, because females, remember, bone fracture can be caused by rosiglitazone and pioglitazone. Both these drugs, B is not the answer. C. Bone fracture can be caused by, okay, pioglitazone I wrote on the wrong side. Rosiglitazone and pioglitazone. Second, it can be caused by SGLT2 inhibitors like canagliflozin. So bone fracture can be seen in both group of patients. It can be seen with these drugs, which are thiazolidinediones, can be seen with SGLT2 inhibitors. Now remember, bone fracture with rosiglitazone and pioglitazone, it is more commonly seen in females, whereas there is no sex predilection with canagliflozin. With canagliflozin, it is more common in elderly, you can say that, but there is no sex predilection. Are you getting my point? So this answer here is not canagliflozin. That would be wrong answer. Rosiglitazone is the right answer for simple reason. Female is mentioned here. Sex predilection is seen with rosiglitazone. So change this answer in your mind. Read the question carefully. Which of the following can be given for long-term management of obesity? Is ionized said June 2021, and it's a very simple MCQ. We have discussed about these as well. Which of the following can be given for long-term management of obesity? Long-term management of obesity. Excellent, guys. A is the right answer, and currently the drug of choice for obesity, remember, currently the drug of choice for obesity are GLP-1 agonist, and it can be liraglutide and semaglutide. Now tell me something. I'll ask you something else. Suppose tomorrow they ask an MCQ, which is the drug of choice for obesity. They give you liraglutide, semaglutide, both in the option. कल आपको एक सवाल पूछते हैं, दोनों दे देते हैं ऑप्शन में, आपको liraglutide भी देते हैं, semaglutide भी देते हैं, तब आपका बेटर आंसर क्या होगा? If they give you both liraglutide and semaglutide in the options, which will be a better answer? दोनों दे दिया तो बेटर आंसर क्या होगा? जल्दी बताओ, कमेंट करके बताओ, जल्दी बताओ क्या होगा बेटर आंसर. क्या होगा हमारा बेटर आंसर? होगा semaglutide. कारण क्या बताओ? कारण वाई semaglutide बेटर होगा. क्यों होगा? वाई, कारण क्या है? व्हाट इज द रीजन? ठीक है, semaglutide, वेरी गुड. सी, I can use both by subcutaneous route. Once a day, OD, and this one is once a week. So even if I use subcutaneous, You understand? I would prefer the drug that is given once a week. Second good thing about this drug is the only oral GLP-1 agonist that is available as of now is semaglutide. So this can be an MCQ, guys. ये एक लौता GLP-1 agonist है जिसको oral route से हम दे सकते हैं. तो whatever may be the reason, you give it subcutaneous or you give it oral, in both the winner would be semaglutide. And you might think, I teach you this always, that I cannot ever give a tide. तो मैं कभी भी एक टाइड को पेप्टाइड को ओरल रूट से दे नहीं सकता, राइट? बट व्हाई एम आई एबल टू गिव semaglutide by oral route is because, see, normally what happens, these are the epithelial cells. Suppose these are two epithelial cells. ये दो epithelial cell है. And suppose this is my peptide. This is my peptide molecule. ज़्यादा ही बड़ा बन गया. Suppose this is my peptide molecule. It is large. It is large and it cannot be absorbed. It cannot pass through the epithelial cell. Now what we do, I combine another drug. I combine another drug or a molecule. Now what this drug or a molecule do? These are actually, they act like a jack. मतलब याद करो, जब भी आपका कार का टायर पंक्चर हो जाता है तो कार को उठाने के लिए नीचे क्या लगाते हैं? जैक लगाते हैं. तो उसी प्रकार ये जो ड्रग है ये जैक की तरह काम करता है. यहाँ पे ये जो ड्रग मॉलिक्यूल है जैक की तरह काम करेगा और ये जो एपिथेलियल सेल के बीच में जो डिस्टेंस है ना उसको बढ़ा देगा. तो ये जो एपिथेलियल सेल के बीच में डिस्टेंस है, ये जो डिस्टेंस है, इस ड्रग की वजह से क्या होगा, ये ड्रग बीच में घुसेगा और घुसने के बाद ये जो एपिथेलियल सेल के बीच में जो डिस्टेंस है इसको बढ़ा देगा. नाउ सी यू कैन सी हियर यू हैव मोर स्पेस. है तो उसने क्या किया, अंदर गया, उसको बढ़ा दिया. एंड नाउ दिस कैन इजीली एंटर थ्रू दिस. दैट इज द रीजन व्हाई semaglutide कैन बी गिवन बाय ओरल रूट. Now other drugs here, they are not used for long term, like sibutramine, fenfluramine, because of toxicity. I can use liraglutide, semaglutide for lifelong. आजीवन यूज कर सकते हैं बिकॉज एंटी डायबिटिक ड्रग है. और डायबिटीज के जो ड्रग होते हैं वो क्या कुछ महीनों के लिए देते हैं? आजीवन देते हैं. वी गिव एंटी डायबिटिक ड्रग्स फॉर लाइफ लॉन्ग. ऑलराइट, नेक्स्ट एमसीक्यू गाइस. Which of the following drug does not require dose modification in renal disease? Now see, it's an MCQ that is asked by AIMS because it was asked in AIMS June 2020. And then once ionized came into the picture, ionized होने के बाद नवंबर 2022 में ये सवाल पूछा गया है. और एम्स वाले जो है ना कुछ क्वेश्चंस को रिपीट करते हैं बार बार. तो एक सवाल है, आंसर इज linagliptin. All of you excellent guys. So remember, all the DPP-4 inhibitors, they are excreted by kidney. DPP-4 inhibitors जो ग्लिप्टिन्स हैं वो किडनी से बाहर जाते हैं. एक्सेप्शन इज linagliptin because remember it's very simple. Remember L for linagliptin and L for liver. So linagliptin, it is the only gliptin, it is the only DPP-4 inhibitor, एक लौता DPP-4 inhibitor जो कि लिवर से बाहर जाएगा. तो ये सवाल आपको काफी बार पूछा जा चुका है. DPP-4 इनिबिटर में याद रखना एक साइड इफेक्ट है जो आपको कभी भी पूछ सकते हैं, which is a serious side effect, angioedema. DPP-4 इनिबिटर्स में दो साइड इफेक्ट हैं, एक इन्फेक्शंस, राइट, इट कैन कॉज एंजियोएडिमा एंड इन्फेक्शंस. सो ये दो साइड इफेक्ट हैं जो कभी भी आपसे पूछ सकते हैं. बिकॉज द यूज ऑफ दिस ड्रग्स इज ऑन अ राइज. दे आर बीइंग प्रेस्क्राइब्ड because a lot of people, they purchasing power parity in India is increasing. People, the salaries are rising, so they can afford costlier drugs nowadays. So DPP-4 inhibitors, oral drugs, ना पता है आपको, तो ये बहुत commonly prescribe हो रहे हैं आजकल. So ये दो side effect है, दो आप पूछ सकते हैं. Pancreatitis होगा, all of them they can cause pancreatitis, but mostly they'll ask MCQ on angioedema or infections. Half-life of letrozole is in hours is कितना घंटा. आयनाइज सेट मई 2022. ये आयनाइज सेट मई 2022 का क्वेश्चन है. आयनाइज सेट मई 2022. आयनाइज सेट मई 2022 क्वेश्चन है. हाफ लाइफ ऑफ लेट्रोजोल इन आवर्स 45 आवर्स. आंसर इज 45 आवर्स. एक्सीलेंट. मोस्ट ऑफ यू हैव गिवन द राइट आंसर. now देखो, Now I want to tell you one thing. See, I have included this MCQ not because I wanted to tell you the answer, because all of you know the answer. You must have solved the PYQs. आप लोगों ने सबने सॉल्व किया होगा. अब एक ड्रग का हाफ लाइफ पूछ लिया. अब इसका मतलब ये थोड़ी है कि मैं हर ड्रग का हाफ लाइफ याद करता फिरूंगा, राइट? सो whenever you prepare for a competitive exam and you come across some MCQs, you might feel the doubt that what if they'll ask about any new drugs half life? So I should mug up all the drugs half lives. ऐसा नहीं करना होता. द रीजन बीइंग, जब भी वो किसी नए ड्रग का हाफ लाइफ पूछेंगे, वो क्वेश्चन सभी के लिए नया होगा. मोस्टली लोग उसको सॉल्व नहीं करेंगे, तो उससे रैंक डिसाइड नहीं होता, राइट? पर अगर ये क्वेश्चन दोबारा आया तो मेरे को 2 सेकंड लगने चाहिए इसको आंसर करने के लिए. सो आई शुड नो द आंसर ऑफ दिस क्वेश्चन. इसका मतलब ये नहीं है कि मैं हर ड्रग, मैं टेमोक्सिफेन, रेलॉक्सिफेन सबका हाफ लाइफ याद करता फिरूं. इट इज नॉट रिक्वायर्ड. It's not a rank deciding MCQ. If it's not a rank deciding MCQ, if new type is asked, right? But if the same question is asked, then it is rank deciding. You have to, because everybody will do this correct. Then you cannot leave it, right? Then you cannot leave it. All right, next question, guys. A female was on tamoxifen therapy for 5 years after surgery of breast cancer, and now she wants to conceive. When can she conceive, right? When can she conceive? Immediately after stopping drug, after 3 months gap, after 1 month gap, can continue and conceive together. Can continue and conceive together. What is the answer, guys? Excellent. ये भी repeat MCQ है. If I go by the standard guidelines, textbooks, they say after 3 months of gap. देखो, textbooks में लिखा हुआ है, हम वही आंसर करेंगे. But the breast surgeons who do surgery, they usually give a gap of 1 year. Practical, देखो पता है ना आपको कि किताबों से प्रैक्टिस नहीं होता. आप जब प्रैक्टिस करने उतरेंगे तो आप पेशेंट से सीखेंगे, अपने सीनियर से सीखेंगे. सो यूजुअली पीपल गिव a duration of 1 year to be on the safer side. But if you read any textbook, they will say 3 months. 3 months, so for answer and for MCQ purpose, you remember 3 months. Second, if they ask you, suppose the MCQ was not about tamoxifen. So I should be prepared about another type of breast cancer, that is HER2 positive breast cancer. So I should be prepared if tomorrow they ask me कि patient को trastuzumab दिया गया है, HER2 positive breast cancer, and now she wants to conceive after how much time? How many months? How many months? देखो, PYQ करने का मतलब सिर्फ ये नहीं है कि मैं क्वेश्चंस का आंसर रट लूं. It's not about just mugging up the answers of the questions. Doing PIQ doesn't mean that. It means you need to learn something collateral. उससे रिलेटेड कुछ चीजें पता होना चाहिए. So you understand, it's quite obvious. They have started asking about this. All right. So just give me. So I'll give you 4 options. I'll give you 4 options. 3 months, 7 months, 12 months, 24 months. If these are 4 options, which option would you pick? Sometimes even if you don't know the answer, you have to a little bit stretch yourself and go overboard to mark some MCQs, right? So, which is it? A, B, C, or D? Now, this is something I have discussed. In your classes. I've discussed this in MCQs as well, and I've told you the answer. It is 7 months, guys. Remember, 7 months. Trastuzumab. Again, excellent. See, Mayur Kaklotkar, if you are marking 12 months, again, it might be a wrong guess, but it is not a bad guess. You understand what is the difference between this? So you have to mark. Even if you're getting it wrong, there is no big deal. It's no big deal, because we have to go wrong. We have to go wrong with some MCQs, and you have to go right with some. Then our entire, number of marks will be positive. Now this is a cake MCQ. 5 alpha reductase inhibitor is given to. So it's an INICET May 2022. 5 alpha reductase inhibitor क्यों देते हैं? Why do we give 5 alpha reductase inhibitor? Decrease serum PSA, increase LH, decrease intracellular testosterone, or decrease intracellular DHT, dihydroxytestosterone? Answer is D. Decrease intracellular DHT. Decrease intracellular DHT, dihydroxytestosterone. So remember, see, 5 alpha reductase inhibitors, drugs which is most commonly asked is finasteride. Finasteride are 5 alpha reductase inhibitor, and there are drugs like androgen receptor blocker, like flutamide, bicalutamide. Now see, the difference is 5 alpha reductase blocker, they will only decrease effect of DHT, dihydroxytestosterone, whereas androgen receptor blockers will decrease the effect of not only DHT but also testosterone. And both of these drugs, what would be their side effects? See, steroid, these drugs they end with steroid, so they will make the patient sterile. स्टीराइल मर देंगे, मतलब स्टीराइल मतलब क्या होता है पता ही आप लोगों को, राइट? इंपोर्टेंस हो जाएगा. अब इन ड्रग्स को देखो, एंड्रोजन रिसेप्टर ब्लॉकर्स, लूटा, दे हैव लूटा, एंड यू नो इन हिंदी लूटा का मतलब क्या है? तो किसी भी मेल को अगर आप ये ड्रग दोगे तो वो मेल को लुटा देगा, राइट? सो ये पेशेंट्स को स्टीराइल बना देंगे, पेशेंट लूट जाएगा, मेल लूट जाएगा, बिकॉज ऑफ इरेक्टाइल डिसफंक्शन, impotence, infertility, gynecomastia. So see, because of these side effects, these are the side effects which can be seen with these drugs. They'll make the patient sterile, patient loot jayega because of these side effects. And if they ask you which is more, then androgen receptor blockers cause more than 5 alpha reductase blocker. Androgen receptor blockers, they will cause more of these side effects as compared to androgen receptor blocker, right? Another MCQ they have asked you, finasteride, its use in BPH. Remember, in BPH, why we use finasteride? Because it decreases size and weight of prostate. So it's an MCQ they have asked. It decreases the size and weight of prostate. It decreases the size and weight of prostate. So they had asked you which drug decreases size of prostate. Tamsulosin will not be the answer. This is the answer. So when we use finasteride in BPH, whenever the prostate is of huge size and because of the sheer volume and size is causing pressure symptoms on the prostatic urethra. To relieve that pressure, I have to decrease the size. And you know that size will not decrease overnight. I will need at least 3 to 6 months for the effect to begin. Means they improve the outcome on long term, right guys? So that's all for today guys. These were the MCQs. Acha, there is one more MCQ. Finasteride, actually androgenic alopecia, excellent. Finasteride is used, so this is ionized at November 2022. So a recent question hai. Finasteride is used to treat male pattern baldness. It acts by inhibiting what? Right, so these MCQs are not difficult. They're easy one. Finasteride जो हम यूज करते हैं मेल पैटर्न बैल्डनेस में, वो किसको ब्लॉक करता है? 5 अल्फा रिडक्टेस को. और आई हैव टोल्ड यू दिस टाइम एंड अगेन इन माय क्लासेस, नेवर यूज देम, नो मैटर हु सेज व्हाट, नेवर यूज इट, because they cause erectile dysfunction, and the dermatologists, they will try to tell you that the risk of erectile dysfunction is only 1 to 3%. But who knows, you are in those 3% or you are in 97%. You never know. You understand? You get my point? And that is the reason why never use this. Then the second point of difference dermatologists will give you is this is a reversible erectile dysfunction. Yes, it is reversible, but the problem is when you are having erectile dysfunction and you are not able to play any match for multiple times, what happens is you get psychological erectile dysfunction, which is very difficult to treat. So irrespective of whatever is the situation of your hair on the head, never use finasteride guys, because see, I do get a lot of messages from students who have already used finasteride, because I tell them not to use, and then they ask me, sir, what should I do? Say, I can't help now, because I can only help not to take it. But if you have taken it, then only we can pray, right? I tell you, right. So we see it's given by dermatologists left and right, because there is effect. It's a good drug as far as effect is concerned, right? And even if you are prescribing, see, I am an ethical person. So even if suppose I will prescribe it, for example, then uh, I'll give a disclaimer to the patient. I'll give a disclaimer to the patient, then let him choose. Because the problem is, what happens is, आपने प्रेस्क्राइब कर दिया किसी को, उसकी दुकान हो गई बंद, एक दिन आएगा आपके माथे में गोली दाग देगा, तो कौन पेशेंट कौन कैसा टकराएगा आपको पता नहीं है. तो इसलिए सबसे पहले अपने आप को सेफ रखो. एंड whenever any drug can change the life of the patient, see, it can almost change the life of the patient, right? You need to give a disclaimer and then let the patient choose if he wants or does not want. So guys, this is all the PYQs we had to discuss today. Whatever PYQs were there in the topic of anti-cancer drugs, endocrinology, anti-cancer drugs and endocrinology, I have discussed those. If you have any doubts, you can ask me, guys. अगर आपका कोई डाउट है तो आप पूछ सकते हैं. See, topical finasteride can cause ED. No, topical finasteride इतना नहीं करता. टॉपिकल फिनास्टेराइड, बट देखो, अगर हेयर लॉस है तो उसके साथ जीना सीखो. और यू कैन गो फॉर ट्रांसप्लांटेशन. आज की डेट पे जो ट्रांसप्लांटेशन का कॉस्ट है, इट इज अराउंड 50,000 फॉर 3,000 ग्राफ्ट. 3,000 ग्राफ्ट का 50,000 रुपए के आसपास पड़ता है. गो फॉर दैट. साइराम, मैब्स, देखो मैब्स, see, what are MABs? MABs is an ocean, and if you try to mug up all the MABs, you will drown in that ocean, right? Now what we need to do, we need to fish out those MABs which are important for us. So only do those MABs which have been asked in previous years PYQs. तो MABs सिर्फ वही करो जो PYQs में पूछा गया है. Some MABs which I've discussed in the class, only do that. Otherwise you cannot do other MABs. See, like emtricitabine. See, they can ask, emtricitabine is not a MAB, Sairam. Ritvik Jha, see, any case of osteoporosis, go for bisphosphonates oral. If there is intolerance, go for IV. If there is no response, or if there is intolerance to even IV one, like you have osteonecrosis of jaw intolerance, then see the risk of fracture. If it is high or very high. If the risk of fracture is high, then go for denosumab. If it is very high, go for teriparatide. बहुत high है, then teriparatide, right? Anti-diabetes mellitus drugs effect on weight gain, loss and neutral. देखो, weight gain, it is caused by pioglitazone. Weight gain will be caused by pioglitazone. It will be caused by sulfonyl ureas, maglidinides. Weight loss will be caused by your SGLT2 blockers, GLP-1 agonist. Weight loss can be caused by SGLT2 blockers, GLP-1 agonists. Weight neutral DPP-4 blockers. Now, if you look at metformin, in some patients it causes weight loss, in some patients it is weight neutral. So metformin comes under comes under both weight loss, weight neutral. Some books write it is weight causes weight loss. Some write it causes weight neutral. So it is both. Sairam, emtricitabine. See, emtricitabine like drugs. The problem is, see, why, like for example, why I don't cover the side effect of emtricitabine like pigmentation of palms and soles, because in India we use lamivudine. In lamivudine, we never use emtricitabine, so you'll never see even a single case of emtricitabine causing pigmentation of palms and soles in India. So see, whenever I teach you guys or any faculty teaches you, it tries to teach you what possibly could be asked in the exam. Because if I'll teach you, all the side effects of each and every drug, then in that case, you'll be overwhelmed and you'll not be able to remember whatever is asked. So see, for example, how I make a judgment of where an MCQ can be asked from HIV, right? So this is benefit plus versus risk. For example, in India, what is the regimen we use? Tenofovir, lamivudine, and dolutegravir, right? So my guess is your MCQs, they will be asked either from tenofovir, lamivudine, dolutegravir, or in young children's, I use LPVR, that is protease inhibitor, class of protease inhibitor. So you'll see, you look at the MCQs, mostly they will be from these drugs or protease inhibitors. The other drugs, they are not that asked. For example, you might have seen NNRTIs are not being asked nowadays. Efavirenz, nevirapine, they are not being asked. The reason being, they are totally out. They are not used in India, right? Dialysis disequilibrium syndrome. See, dialysis disequilibrium syndrome. See, I've taught you this in your exams. I mean, in your classes, I've told you that it is one of the uses of mannitol. मैरो में मैंने आपको पढ़ाया है कि डायलिसिस डिसइक्विलिब्रियम सिंड्रोम मैनिटोल का यूज है. ये हालांकि कभी आज तक नहीं पूछा है, कभी नहीं पूछा किसी ने, बट आई स्टिल टोल्ड यू. नाउ व्हाट इज डायलिसिस डिसइक्विलिब्रियम सिंड्रोम? सी व्हाट हैपेंस इज, डायलिसिस में क्या करेंगे, व्हाट यू विल डू इन डायलिसिस, यू विल ट्राई टू फिल्टर द प्लाज्मा, राइट? सो डायलिसिस what it can do is, if I overdo, अगर मैं ज्यादा हो गया डायलिसिस, more than required, it will significantly decrease uric acid in plasma. तो डायलिसिस डिसइक्विलिब्रियम में क्या होगा, यूरिक एसिड प्लाज्मा में कम हो गया. And whenever uric acid decreases in plasma because of dialysis, it will decrease the osmotic pressure. It will decrease the osmotic pressure. And just imagine in your body, you see, uric acid is osmotic in nature. And it is important for osmotic pressure in our plasma, right? अब मैंने क्या किया ना, मैंने जरूरत से ज्यादा डायलिसिस कर दिया, यूरिक एसिड बहुत ज्यादा कम हो गया, तो ब्लड में क्या होगा, ऑस्मोटिक प्रेशर कम हो जाएगा. और जब ऑस्मोटिक प्रेशर कम होगा, तो ये मेरा ब्लड वेसल है, यहां पे ऑस्मोटिक प्रेशर कम हो गया, और ये सपोज मेरा ब्रेन है, तो क्या होगा, जो वाटर होगा ना, वाटर वो सेल्स के अंदर शिफ्ट कर जाएगा, सेल्स के अंदर, न्यूरॉन्स के अंदर शिफ्ट कर जाएगा, और उसकी वजह से क्या हो सकता है, सेरिब्रल एडिमा हो सकता है. तो उसकी वजह से सिम्टम्स आएंगे, नॉसिया, वॉमिटिंग, हेडेक एटसेट्रा. उसको हम कहते हैं डायलिसिस डिसइक्विलिब्रियम, राइट? हाँ, ये क्वेश्चन पूछा है कोहली, ये क्वेश्चन नीट पीजी 2023 में पूछा है, और ये मैंने पढ़ाया है, आप लोग मैरो में पढ़ाया है मैंने आपका यूज, डायलिसिस डिसइक्विलिब्रियम सिंड्रोम पढ़ाया है मैंने आप लोगों को. मैंने डिटेल में डिस्कस नहीं किया था बिकॉज आज तक कभी पूछा नहीं है, बट मैंने सिर्फ आपको ये बोल दिया था कि एक यूज है इसका, एक यूज मैंने आपको बताया था. डायलिसिस डिसइक्विलिब्रियम सिंड्रोम एक यूज बताया था मैंने आपको, जो कभी नहीं पूछा था, अभी पूछा नीट पीजी में. एक और यूज मैंने आपको इसका बताया हुआ है, दैट इज इफ देयर इज अ पेशेंट ऑफ impending renal failure. ये मैनिटोल का एक और यूज है, आज तक पूछा नहीं है, पर ये पढ़ा है मैंने आपको, impending renal failure में यूज हो सकता है. बट रिमेंबर, मैनिटोल इज कॉन्ट्रा इंडिकेटेड इन renal failure. मेनिटॉल रीनल फेलियर में नहीं थे। देखो ये जो छोटी छोटी बातें हैं ना, ये पता होनी चाहिए आपको, छोटी छोटी बातें आपको पता होनी चाहिए। इम्पेंडिंग रीनल फेलियर का मतलब रीनल फेलियर अभी हुआ नहीं है। इम्पेंडिंग मीन्स इट इज एक्सपेक्टेड दैट द पेशेंट माइट गो इनटू रीनल फेलियर सून, but it is not yet frank renal failure. So I'll try to avoid that renal failure by giving mannitol, which will draw more plasma into the glomerulus, filter more, and because of that GFR would increase. But अगर renal failure हो गया है, उसमें पेशेंट मर जाएगा बिकॉज मैनिटॉल फिल्टर नहीं हो पाएगा, क्योंकि भाई जीएफआर है ही नहीं, और उसमें सारा का सारा मैनिटॉल आपके बॉडी में रह जाएगा, ब्लड वेसल में। उससे होगा क्या कि बहुत सारा पानी ब्लड वेसल में आ जाएगा, हाइपर वोलेमिया हो जाएगा, द पेशेंट माइट गो इनटू कंजेस्टिव हार्ट फेलियर, पल्मोनरी एडिमा हो सकता है। ऑलराइट, ऑलराइट गाइस, और क्या पूछा आप लोगों ने? डॉक्सोरोबिसिन डाउनोरोबिसिन में कंफ्यूजन है। भाई डॉक्सो और डाउनो में कंफ्यूजन क्या है? दोनों भाई हैं, डॉक्सो और डाउनो दोनों भाई हैं, दोनों का यूजेस एक जैसा है और दोनों का साइड इफेक्ट भी एक जैसा है। दोनों कार्डियोटॉक्सिसिटी करते हैं, दोनों के कार्डियोटॉक्सिसिटी को प्रिवेंट करने के लिए हम आयरन चिलेटिंग एजेंट्स यूज करते हैं, जैसे कि डेक्सराजोक्सान को यूज कर सकते हैं आप उसमें। और दोनों का जो यूज है डॉक्सो और डाउनोरोबिसिन, दे कैन बी यूज्ड इन लिम्फोमा, मोस्ट इंपॉर्टेंट इज लिम्फोमा, और आप यूज कर सकते हैं सार्कोमा में, लाइक ऑस्टियोसार्कोमा यूज कर सकते हैं। बाकी दोनों में कोई अंतर नहीं है ऐसा। और आई गेस सो दिस इज व्हाट वी हैव टू डिस्कस टुडे। बाकी दोनों करते हैं भाई, दोनों करते हैं। डेक्सराजोक्सान भी यूज डेक्सराजोक्सान। डॉक्सो और डाउनो में कोई खास अंतर नहीं है, ये राम और श्याम है, ये दोनों राम और श्याम है, ये दोनों जुड़वा हैं, ये दोनों देखने में एक जैसे हैं, राइट? तो कोई खास इनमें कोई खास अंतर नहीं है। देखो अगला, फॉर द नेक्स्ट सेशन आई हैव ऑलरेडी पोस्टेड टुडे ओटाकॉइड, देयर वाज ओटाकॉइड, RSP, GIT, I think the topics are, or whatever it is. I posted the timetable for next week. Try to revise them, try to solve the PYQs. Come, we'll discuss. I'll try to do next Sunday. Next Sunday I might be able to do it. I'll do it on Sunday or Monday, right? If I'm not available on Sunday, because I have a class, so it might be Monday. But anyways, Sunday or Monday, 9 o'clock, I'll come. We'll do the live session, and we'll be done with that. So guys, good night all of you. Sweet dreams, and keep studying hard for the INI set. Those who have not done well in the NEET PG. So one student asked me, sir, I did not have a very good rank in NEET PG. My rank was some 22 or 24,000. Now, should I expect that I can get a good rank in INI set? Why not? Why not? Who said that a rank of 22 or 24,000 automatically moves you out of the competition in INI set? There is nothing like that, guys. There is absolutely nothing like that. Believe me, even to get a rank of 20,000, 22 or 24,000, you have to study. स्टूडेंट्स जिन्होंने एग्जाम दिया उनको पता है कि 20,000, 22,000, 24,000 रैंक भी बैठे बैठे नहीं मिलता, उसके लिए भी घिसना पड़ता है। और अगर आपको एक दिन आपका रैंक, एक दिन के एग्जाम में अगर आपका रैंक आप एक्सपेक्ट कर रहे थे कि 2-3 हजार आएगा, अगर वो 20,000, 22,000, 24,000 आया, इसका मतलब नहीं कि आप बुरे स्टूडेंट हो। किसी का भी एक दिन खराब जा सकता है। एनीबडी कैन हैव वन बैड डे। सो बहुत से स्टूडेंट ने उस दिन अच्छा परफॉर्म नहीं किया, उस दिन दिमाग नहीं चला, उस दिन एंग्शियस थे, वो दिन खराब था बिकॉज ऑफ सम रीजन, एंड यू कुड नॉट लिव अप टू योर एक्सपेक्टेशन। बहुत से बच्चों ने कहा सर ग्रैंड टेस्ट में तो बहुत अच्छे मार्क्स आते थे, बहुत अच्छा रैंक आता था, ग्रैंड टेस्ट मैरो में देते थे, पर एग्जाम में पता नहीं चला ऐसा कैसा क्या हो गया। क्या हुआ बताता हूं आपको, डिफरेंस क्या है। एग्जाम में आपको एक्सपेक्टेशन बहुत ज्यादा होता है अपने आप से, और प्रेशर, उस एक्सपेक्टेशन का प्रेशर होता है हमारे ऊपर, क्योंकि एक तो हमें अपने आप से उम्मीद होती है कि भाई मेरे को ये रैंक लेकर के आना है, फिर आगे इस सब्जेक्ट में PG करना है, फिर शादी करनी है, घर वालों को खुश करना है। भाई ये है ना हमारे दिमाग में चलता है, ये हमारे अपना थॉट प्रोसेस चलता रहता है, तो ये हमारा एक्सपेक्टेशन है। फिर हमें पता है कि हमारे आसपास के लोगों का एक्सपेक्टेशन है हमारे ऊपर। माँ बाप सोचते हैं कि कब ये जो है कम वक्त पैसा कमाना चालू करेगा और हमारी गर्दन छोड़ेगा, तो माँ बाप अपने जुगाड़ में रहते हैं वो कब तुम इंडिपेंडेंट होगे, कब उनकी मदद करोगे। तो सबके एक्सपेक्टेशन होते हैं हमारे ऊपर, और वो प्रेशर इतना ज्यादा होता है कि उस दिन कई बार गड़बड़ हो जाता है। इसको जस्ट ऐसे ले लो कि नेट प्रैक्टिस में चौके छक्के मारना बहुत आसान है, लेकिन जब आप पिच पे जाते हो ना बैटिंग करने के लिए, पिच पे और आप खेल रहे हो और 50,000 स्टेडियम में लोग भरे हुए हैं, तो वो 50,000 में जो आपके सपोर्टर होंगे 20-25,000 लेटर सपोज, तो उनका उम्मीद है आपसे कि आप बैटिंग करने जा रहे हैं, आप चौका छक्का मारेंगे। तो वो जो उम्मीद है ना, उम्मीद आपसे, अपने आप से, वो प्रेशर क्रिएट करता है। और उस प्रेशर सिचुएशन में कई बार आप ऐसे शॉट्स मारते हो जिसके लिए आप नहीं जाने जाते। तो आपने देखा होगा कोहली हो गया, इवन आपका हिटमैन हो गया रोहित शर्मा, ये भी कई बार बेवकूफ़ी भरे शॉट मार के आउट होते हैं। तो वो लगता है कि बेवकूफ़ी भरा शॉट है, बट वो भी अंडर प्रेशर होते हैं, राइट। सो इफ यू हैड अ बैड डे इन नीट पीजी, यू हैड अ रैंक ऑफ 20,000, 22,000, 24,000, कोई फर्क नहीं पड़ता, कोई फर्क नहीं पड़ता। आप आईएनआई सेट में आ करके अंडर 1,000 रैंक ला सकते हैं, ला सकते हैं, बशर्ते आपको ये सोच करके पढ़ाई करना है कि मैं क्यों पढ़ रहा हूं, मैं इसलिए पढ़ रहा हूं बिकॉज आईएनआई सेट में मेरे को बहुत अच्छा रैंक लाना है, राइट। तो अगर वो पॉजिटिव थॉट के साथ पढ़ेंगे तो बिल्कुल आ सकता है। तो पहली बात है कि अगर आप अपने आप से उम्मीद नहीं रखेंगे तो आप अपने आप से काम कैसे करवाएंगे, समझ रही बात, राइट। ऑलराइट गाइस, थैंक यू गाइस, थैंक यू कोहली, शैशवानी, सायराम, कोहली आई डोंट वॉच आईपीएल। मैं एक्चुअली आईपीएल के ऑरा से ना मैं ऊपर चला गया हूँ, मैं आईपीएल नहीं देखता। क्रिकेट मैचेस में पहले देखता था, खेलता भी था, बट नाउ इट इज आई डोंट वॉच। ऑलराइट, रिवर्सिबल इरिवर्सिबल, reversible irreversible autotoxicity. See, for most drugs it is reversible, right? Irreversible, it is seen with drugs like aminoglycosides. Aminoglycosides, they cause irreversible toxicity because of damage to the neurons. अदरवाइज बाकी जितने ड्रग्स हैं सारे रिवर्सिबल, जैसे फुरोसमाइड हो गया, सिस्प्लेटिन हो गया, उनका ऑटोटॉक्सिसिटी मोस्टली इट इज रिवर्सिबल। ऑलराइट, नो किलर, थैंक यू वेरी मच. Alright guys, good night all of you. We are done for today. I'll see you on the next live session. Lots of love and blessings to all of you. Take care guys. I love you all.